Hello students, let's continue our lecture on class 3 antiarrhythmic drugs, that is potassium channel blockers. Examples include Bettiah, Abutylide, Doftilide, Amiodarone, Dronedarone, Sotalol and Vernacalant.
Dronedarone. An example of class 3 antiarrhythmic drug, that is potassium channel blocker. It is derivative of amiodarone. Mechanism of action of dronedarone is similar to amiodarone. Now, dronedarone is less lipophilic as compared to amiodarone, so apparent volume of distribution will be less. So less deposition in body, so it has short half-life, that is 24 hours. So no loading dose is needed in case of dronedarone. Other important feature of dronedarone, it does not contain iodine, so does not affect thyroid function. It is less toxic and it has less efficacy. Now, side effects, it has mainly gastrointestinal side effects like nausea, vomiting, diarrhea and abdominal pain. Now, what are the contraindications of this drug dronedarone? First contraindication is it is contraindicated in pregnancy, and second, it is contraindicated in congestive heart failure. So dronedarone example of class 3 antiarrhythmic drug, that is potassium channel blocker, derivative of amiodarone. Mechanism of action is similar to amiodarone. It is less lipophilic, this is important, as compared to amiodarone. So less apparent volume of distribution, less deposition in body, so it has short half-life, that is 24 hours, and no loading dose is needed. It does not contain iodine, so does not affect thyroid function. It is less toxic and it has less efficacy. Now, side effects, mainly GI side effect like nausea, vomiting, diarrhea, abdominal pain. And contraindications, it is contraindicated in pregnancy and it is contraindicated in congestive heart failure. Sotalol. Sotalol is class 3 antiarrhythmic drug, that is potassium channel blocker. Sotalol is also beta blocker, so it is also class 2 antiarrhythmic. Sotalol is non-selective beta blocker, that is it is beta 1 blocker plus beta 2 blocker. Sotalol there is no first pass metabolism in case of sotalol and it is given orally. Sotalol is water soluble beta blocker. So it is contraindicated in renal failure. Water soluble drugs are eliminated via kidney. So this is all important points regarding sotalol. This is drug sotalol, example of class 3 or class 3 antiarrhythmic, that is potassium channel blocker. It is also a beta blocker, so it is also example of class 2 antiarrhythmic. It is non-selective beta blocker because it blocks beta 1 receptor as well as it blocks beta 2 receptor. There is no first pass metabolism. It is given orally. It is also example of water soluble beta blocker. So it is contraindicated in renal failure because water soluble drugs are eliminated via kidney. Ibutylide is example of class 3 antiarrhythmic drug, that is potassium channel blocker. Ibutylide has very high first pass metabolism. So it is given intravenously. It has only potassium channel blocking activity. Only potassium channel blocking activity and maximum potassium channel blocking activity. Side effect of ibutilide is torsade Dpoints. Important side effect of ibutilide: torsades Dpoints. Now, torsade Dpoints is example of ventricular tachyarrhythmia. Now, what is the characteristic of torsades Dpoints? They will be polymorphic ventricular tachycardia plus prolonged QT interval. Since QT interval is prolonged in case of torsade Dpoints, that means repolarization is prolonged. And polymorphic means, poly means multiple, and morphic signifies QRS interval. And the meaning of torsade Dpoints word meaning is twisting of points. Ibutilide side effect. Important side effect of ibutilide: torsade Dpoints, and is characterized by polymorphic ventricular tachycardia plus prolonged QT interval. Prolonged QT interval means repolarization is prolonged, and polymorphic means there will be multiple QRS interval. And the meaning of torsade Dpoints word is twisting of points. The main indication of ibutilide is acute attack of atrial fibrillation or atrial flutter. So it is drug of choice for acute attack of atrial fibrillation or atrial flutter. Let's see the management of atrial fibrillation. Or atrial flutter. Rhythm control. Rhythm control meaning to convert atrial fibrillation back to sinus rhythm. And for rhythm control, amiodarone is drug of choice. For rate control, beta blockers are drug of choice. In case of acute attack of atrial fibrillation, or atrial flutter. Cardioversion is treatment of choice. If it is not effective, then intravenous Ibutylide is drug of choice. Then repeat cardioversion. So Ibutylide, drug of choice for acute attack of atrial fibrillation or atrial flutter. In management of atrial fibrillation or atrial flutter, for rhythm control, amiodarone is drug of choice. For rate control, beta blockers are drug of choice. And in case of acute attack of atrial fibrillation or atrial flutter, cardioversion is treatment of choice. Cardioversion is the medical procedure by which arrhythmia is converted back to sinus rhythm using electric shock. And if cardioversion is not effective, then intravenous Ibutylide is drug of choice, followed by cardioversion. Next drug is Doptilide. Doptilide is again example of class 3 antiarrhythmic drug, that is potassium channel blocker. Doptilide is given oral. And is given for prophylaxis or long-term treatment of atrial fibrillation or atrial flutter. One important point regarding Doptilide, it has only potassium channel blocking activity. Important side effect of Doptilide is torsade Dpoints. So this drug Doptilide is example of class 3 antiarrhythmic drug, that is potassium channel blocker. It is given oral for the prophylaxis of atrial fibrillation or atrial flutter, for the long-term treatment of atrial fibrillation or atrial flutter, and it has only potassium channel blocking activity, and side effect is torsade Dpoints. Next drug is Bettiah. Bettiah is example of class 3 antiarrhythmic drug, that is potassium channel blocker. efficacy. And is not used nowadays. Bettiah was used intravenously for treatment of life-threatening ventricular arrhythmia. And was known as medical defibrillator. These are important point about Bettiah. It is example of class 3 antiarrhythmic drug, that is potassium channel blocker. Since it has less efficacy, so not used nowadays, and it was once used for the treatment of life-threatening ventricular arrhythmia intravenously and was known as medical defibrillator. Next drug is Varnacalent, example of class 3 antiarrhythmic drug, that is potassium channel blocker. It blocks other ion channel also, so it is multi-ion channel blocker. It is administered intravenously for treatment of atrial fibrillation. It is also effective orally. Side effects of Varnacalent: cough, dysgeusia. Dysgeusia means abnormal taste. And hypotension. This drug Varnacalent is class 3 antiarrhythmic drug, that is potassium channel blocker. Since it blocks other ion channel, it is multi-ion channel blocker. It is given intravenously for treatment of atrial fibrillation. It is also effective orally, and the side effects include cough, dysgeusia, hypotension. In the next lecture, we will study about class 4 antiarrhythmic drugs. Thank you.